Dr. Kelly Vaughn here with Restore in 24. I wanted to make a quick video answering one of the most common questions we get asked about All-on-4 full mouth dental implants. And that's, what do I have to do after I get these? How do I take care of them, or how do I clean them? First, let me just say, so many times people come in to consult with me thinking this is better than their natural teeth. Since you don't have to worry about tooth decay, they think it's a fix it and forget it solution. And I just want to say, full mouth dental implants, aka All-on-4, is awesome if you're missing several teeth or you're in a denture and you want something better. All-on-4 is perfect for replacing a full arch or full mouth of teeth, but it's not like you get these teeth and never have to worry about anything ever again. There is maintenance with these, just like anything. So what is it? The key to long-term success of full mouth dental implants is the implants themselves. So this is what I would recommend. Your daily at-home care should start with brushing the teeth. First thing you're going to want to do is get a soft bristled toothbrush. A soft toothbrush is always recommended, whether you've got natural teeth or All-on-4 teeth. But unlike natural teeth, with All-on-4, you're going to want to not only brush the teeth themselves, but also the pink part where the gums are. So you'll want to go in circular motions and make sure that you're cleaning not only the teeth, but also the pink part that's replacing your gums. You'll also want to use a non-abrasive toothpaste, and I've included a link below in the description with some of the recommended products for you. Now, the material used for these All-on-4 teeth is very hard and stain resistant, but you don't want something too abrasive because it's kind of like using a fine grit sandpaper that over time could introduce little scratches that can allow stains to be picked up. You'll also want to get something like this. This is Super Floss, which is kind of like a needle for thread. There's a rigid end attached to floss, and what this does is it allows you to get under the teeth and floss in between the implants. Now, unlike natural teeth where you floss in between the teeth, with All-on-4 you're going to be flossing under the teeth. So you're flossing where this meets the gum underneath, and you're sliding it back and forth in between the implants. Now, after flossing, you're going to want to rinse underneath with a water flosser. Now, any water flosser will work, but I always recommend the cordless water flosser because water flossers can get a little messy if you've ever used one. So I always tell patients, take this in the shower with you. That way you can make a mess and it's going to get cleaned up on its own. So what you're going to want to do after using that super floss and brushing the underneath of this, you're going to want to take your water flosser and just irrigate in between the gums and these teeth. Now, a lot of people don't want to floss, whether they've got natural teeth or All-on-4. But I tell everyone it's kind of like washing your car only with a spray wash and never picking up a sponge to scrub it. If you really want to get your car clean, you'll scrub it to loosen everything, then rinse it. And these teeth are no different. So these are the three main things you'll want to do. You're going to want to brush them, you're going to want to floss under, and then you're going to want to rinse under. Then you can also add things like a tongue scraper, which is going to remove the bacteria from the tongue. So you brush the teeth, then you're going to brush the tongue, and then scrape it. There's also various mouth rinses, and really you can pick any rinse that you like. It's going to give you an extra minty fresh finish, and some of them even kill bacteria. Now, if you like using mouth rinse, I always recommend a clear rinse. Again, all of these materials are very hard and stain resistant, but using a clear rinse is just going to ensure that there are no stains picked up as time goes on. You can also pick up something called a proxy brush. Now, these are some by Oral-B, and this is my personal favorite. These are nice to carry around with you when you're out and about, and it's good for All-on-4 or natural teeth. Now, for All-on-4, you use these underneath like the floss. So basically, maybe you're out to eat with friends and you just got finished with a meal and you just like keeping these things extra clean, but you don't carry the floss around with you or it's not super convenient. I carry these around with me everywhere I go. So what makes them nice is they're super small, super convenient. Some of the packaging comes with its own little case that you can carry them in. So you're just going to go underneath the teeth and then scrub just like a little brushing motion. Now again, I've put all the links to all of this stuff, what I recommend, in the description below. So brush, floss, rinse twice a day, every day, and then you'll want to be seen usually twice a year by the dentist. Now at those visits, an image is going to be taken so that the bone and the implants can be evaluated, and then a cleaning will be done. It's kind of like getting an oil change and maintenance for your car. This is a big investment, and it's really about the same price as a car. So just like a car, you're putting miles on it, using it every day. You're going to want to come in periodically to make sure everything checks out. So if there ever was a problem, it can be caught sooner rather than later. Now, the other question that goes along with this is, do we take the teeth out at these appointments? The short answer is only if we have to. The All-on-4 teeth are screwed into place, so it's a mechanical connection. And we don't want to put on and take off too much unless we really need to. That way we're avoiding compromising the connection. Another question we get asked is, what can I eat with these during the healing phase and after when I get my final teeth? If you want the answer to that question, check out the next video. I hope you found this video helpful, and I look forward to seeing you again soon.